People think of an injection therapy for their hair as the holy grail of hair therapy. If I just came in and got a couple of injections every, small time period, you could keep your hair, especially if you started early enough. It's not quite there yet, but there are a lot of promising therapies in use in our office right now. One thing that we've been using for a while is platelet-rich plasma. Platelet-rich plasma, by our own data, can help over 70% of women and about 60% of the men who use it. Our patients are really happy with how it works to make their hair feel fuller, but it only works in the areas that you actually inject, and it does require maintenance. This is not going to cure your hair loss. The other thing to know about platelet-rich plasma is that not every practitioner does it the same way. Right now, it is kind of the Wild West of platelet-rich plasma out there. Everyone is using different machines and different concentrations, and knowing what your platelet concentration is quite important. So we used to think that 3 to 5 times platelet concentration was really important, 3 to 5 times that of normal blood. Now we think that higher is better, 8 to 10 times. And the hypothesis behind all this is that platelets contain within them growth factors. And these growth factors, once they are in an area where they get activated either by tissue damage or with calcium gluconate or some of these other activators, they will then burst themselves open and release those growth factors into the tissue, thus stimulating hair growth and healing in other cases. There's other ways of getting these growth factors. So exosomes are another little tiny packet of growth factors. It is also a little bit like the Wild West. Some come from their own stem cell lines. Some come from placental fetal medicine. We're not really sure sometimes where they come from. And as with most of the therapies in hair, it is a little bit like putting the cart before the horse if you treat somebody without the data. Early data has been positive, which is why we are very honest with our patients about the risks. There's probably very few side effect risks, but the risk is that you might inject the top of your head and not see the result that you were looking for, and then you're out the money and the time. And exosomes, if they do 100% work, and we're not sure to what extent they would work in individual patients, but if they do work, they are currently a very expensive option. So if you have the means and this is something that you want to try, absolutely, exosomes are something that we can throw at your head, so to speak. However, platelet-rich plasma is another option, and we have patients who've been on that for years. And the medical therapies that we have spoken about, finasteride, minoxidil, some shampoos, and low-level light therapy are all additional medications and medical therapies that you could put towards regrowing your hair.